Coming to you live from the Now Media Newsroom.
I'm Jim Check. You're watching Now Media with me, MLA Peter Millibar for the BC Conservative Party. And health crisis in Kamloops, a mass resignation. Like that is just, I don't even know what the words to say. Wow, wild, but it's got to be shocking for that community, and I'd even say shocking for British Columbia in general. But this is not the first one. We've seen this in Kelowna, where we've seen resignations in the pediatrics. What's going on in Kamloops right now?
Well, shocking is one word, absolutely. Unnerving is another. I mean, you can run through the thesaurus and probably hit an accurate descriptor. It's just very frustrating. We've been dealing with this for several years now. Maternity services. We have an obstetrics clinic that does off-site work as well. It's always been under funding pressures and a threat of closing or not. We've had midwife clinics that sometimes get funded by Interior Health and sometimes don't. There was one situation where they even said, well, even though your contract runs out on March 31st, we'll have money for you in June. But not that first quarter of the year. We had to fight to get that restored at the 11th hour, because apparently pregnant women can just magically wait an extra 3 months, as if the baby's not still growing. So this has been an ongoing issue in Kamloops for a long time. The biggest, frustration out of all of this is these OBGYNs have been trying literally for years now to engage with the minister, to engage with Interior Health, providing actual solutions to what they see as recruitment issues, pay issues, workplace issues, you name it, everything that's been mentioned in their letter. And they've been rebuffed at every opportunity. And so, it's not from lack of attempts by them to make the system better and make it operate the way it needs to operate in their eyes. And this, frankly, is a province-wide issue. And so Kamloops is the first. I'm not trying to be an alarmist. I've said this in other media interviews. But we saw Prince George with massive maternity pressures this summer as well. A few weeks later, Kamloops had them. Now we're seeing the ultimate step being taken. But make no mistake about it, if this government thinks that they can just keep operating under the status quo and ignoring healthcare professionals, you want to ignore me, I'm an opposition politician. I get it. But I'm merely voicing what I'm hearing from healthcare professionals in the system as what they see as the problems that need to be fixed.
Yeah, this is like, again, I don't even have many words for it. It's kind of shocking. This is a mass resignation of 7 gynecologists all at once. And, they're saying basically it's come down to workload, inability to recruit, and all these other issues. And I guess if this was just Kamloops, you might say, okay, that's, maybe there's something going on in that hospital. But, the former Interior Health CEO lost her job from the pressures that happened with the Kelowna pediatric situation. And then they put in an interim, then they rewarded her the job of CEO. But not much has changed, because, because the Kelowna pediatrics was closed for quite a while there. I think it was like 6 to 8 weeks or something like that. And it just seems to be like this is like a whack-a-mole, one problem over here, another problem over here, and it seems to be more than just an Interior Health problem too. We're seeing some crisis going on with the Fraser Valley Health Authorities and stuff like that. But the BC government steps up to the podium, says they're doing recruiting. They say they got all these numbers, yet it obviously is not showing up and translating into real results, and this is where the frustration boils over.
Yeah, and obviously pediatrics is different than the OBGYN specialty as well, but still, childcare related, maternity related. Prince George, it was specific to maternity. They had issues there in the summer, a few weeks, and after being told to head to Kamloops, if you're in the Prince George region, a few weeks later, Kamloops had maternity ward issues. And it's not just the OB side of the OBGYN that is of concern here. This is about women's health in general. It's not just about pregnant women, but this is about, the services that will or won't be provided in Royal Inland Hospital, which is supposed to be a tertiary hospital for access for women's health issues in a wide range of things and tests and biopsies and other things that they need to have happen, all related to themselves with their reproductive systems and everything else. And so, again, I fall back to this is what the medical professionals within the system themselves are saying needs to change and what steps need to be taken. And it's only under crisis management does this government want to actually listen and potentially even take steps. When we had issues in the summer, I called on the Minister of Health then to provide a very clear way forward, a plan that the government was prepared to fund in action to try to stabilize what was going on with maternity care and OBGYN services within Kamloops and Royal Inland Hospital. That was met with silence. The doctors themselves have been trying for multiple years to get an answer out of the government about the changes that want to be made. And so, I'm far from Interior Health's cheerleader. I never have been my whole political career. I'm not saying that they're totally blameless in all of this either. But it was a little frustrating, to get the stock answer back that they're not in charge of recruitment and things of that nature. We're talking about hospital credentialing. Interior Health runs the hospital. How the heck do you run a hospital if you don't have credentialed doctors? And so, they do need to take a bigger ownership stake when it comes to recruitment and retention, especially as it relates to things like a tertiary hospital within their system.
Communication has been highlighted, and we highlighted it as well. It's almost impossible to get information. We've asked for several interviews with the CEOs, past and present, and those are elusive as well. And even the mayors, there was a bunch of mayors in the Okanagan region that sent a letter that was leaked, that, they didn't come forward, that letter was leaked. And that was a letter from 2 years ago where there's a lack of communication. This is an ongoing problem with Interior Health and the BC ministry. And then nobody seems to want to take ownership. And communication is obviously, you can't really fix a problem that nobody really knows about, that keep trying to hide under the rug. And in Kelowna, they talked about a toxic work environment, all kinds of things. And it sounds like these doctors, this is the last step you take, right? Because this doesn't look great on the doctors either to do this mass resignation. Have you had a chance to speak with any of these doctors yet?
I haven't yet. I will be meeting with them later, and certainly they've reached out and yesterday, and so we're trying to find a time that will work for people, and really, again, on the communication side, Interior Health has a massive communication department. If ever there was a time to step up your game on communication, now would be the time. And I say that more in regards to the public. There is mass concern within Kamloops right now by women, understandably, in terms of what this means moving forward. Now, we need to have a very clear understanding what Royal Inland Hospital operationally will look like, how they plan on still filling the 7 doctors' positions that no longer are working out of the hospital. What timeline does that actually look like that they're not any longer working in the hospital? Those types of things. What's the plan with locums? What's the plan and timelines around hiring in new OBGYNs? All of that needs to be communicated very, very clearly and concisely, and it needs to be done by Interior Health and the Minister of Health. This can't be myself or other MLAs, operating on partial information on something as serious as this. And so they need to step up, and simply avoiding media interviews, if you're the Minister of Health, doesn't cut it. We need to know what the plan is, what the true state of play of that hospital is, so that people trying to access health care know exactly what to expect or not, and can make decisions and plans with their current health care provider accordingly.
We did a story this morning. We do the 9 o'clock news every weekday morning. And in that, we talked about that they're finally going to do a study. The Commons Health Committee is finally going to do a study to investigate how much immigration's impact has had on people's access to free healthcare, because they're still advertising out to the world, come to Canada for free healthcare, when free but hard to access. And I think you made a point here. 40%, is it 40% you said in your quote here? 40% of Kamloops residents don't have a family doctor. And yet we're still advertising to the world, come to Canada for free healthcare.
Well, I want to be clear here. Although Kelowna has awakened to the mess sometimes that interior health can be, Kamloops has been dealing with that for decades, almost since inception with interior health. We have said for years now, if you're calling us a tertiary hospital, and we know what the standard of a tertiary hospital is based on Kelowna, we should be funded and in the same fashion. And so, we had the first urgent primary care center open in Kamloops in the province, and in short order, our walk-in clinics all closed. I've warned about this for years now, that be careful what you wish for. They're very expensive to operate. They're not very efficient, and they close walk-in clinics. Urgent primary care center opens in Vernon. What happens to their walk-in clinics? Or it opens in Prince George. What happens to their walk-in clinics? You can track all of this stuff, and it's all happened under the watch first of Adrian Dix and now Josie Osborne as the health ministers. They were able to cloud a bit of what was going on with COVID and the chaos that ensued in the healthcare system then. But make no mistake about it, our healthcare system was already starting to diminish pre-COVID. COVID had definitely exacerbated things, we need to get to a place where there's, a government willing to actually listen to the medical professionals. I say this all the time in Kamloops, whether it be our lack of having a catheter lab and interior health saying not till 2040. So we're rationing cardiac care in Kamloops, even though our cardiac surgeons want it. And we have donors to pay for the equipment. Our cancer center design is going to be the only one designed this way in the rest of the country, if not North America, the way they're designing it. And it's going to be a recruitment nightmare. And they've been warned for years, and they stubbornly insist on still designing it the way they are. Maternity care services is a problem. Ophthalmology, we've been struggling to try to get a third ophthalmologist with OR time because Interior Health won't approve that, even though there's 10 in Kelowna. And so, as bad as you may think you have it in Kelowna, folks, I got to say, it's not news to Kamloops in terms of these struggles. The point on all of those examples I just gave, and those are all happening all at the same time in Kamloops right now, by the way, is I'm simply relaying what I'm hearing back from either oncologists, from OBGYNs, what I'm hearing from ophthalmology patients, these are all actually coming from medical professionals, these issues and the concerns, the cardiac surgeons, and they're being ignored. And when you talk to the government or when you talk to Interior Health, they say, well, we rely heavily on doctors and their opinions on things. Well, you don't. You do when it suits you. And then when you choose to ignore them, which seems to be the majority of the time, there's always some reason why not to advance what they're actually saying. So this is the overlying and underlying frustration. It's sad to see, frankly, Kelowna is starting down this path as well, because that means your healthcare in your region is starting to suffer. And this isn't about taking away from one region to bolster another. It's about trying to actually improve the healthcare system overall. When your pediatric was shut down, a lot of those patients started coming to Kamloops. That put pressure on our pediatric system, and so we were happy to help out. But as soon as there's a shutdown in one area, it does stress the whole system that's already under pressure across this province.
So what do you think is the biggest problem with the NDP's BC NDP in the way the ministry is being run or the government is being run? Like, what don't they get? Is it their own? They've got an ideology that they're chasing down the road, or is it funding, or what is it that they can't seem to get? Why don't they? And I guess the question is, are they sharing information with you, and they're not taking information from the doctors, as you say? So what drives them?
I'm not entirely sure, to tell you the truth. We've warned for years, again, about bureaucratic bloat within health authorities. It was ignored by the government, and now magically they've found a way to cut, 150 or something like that, administrative positions out of Fraser Health or Interior Health and PHSA. How do you cut that many administrators out? Why did you hire them in the first place if you can cut them and not impact services? So, there's been a lot of money. There's been a lot of questionable hiring and expansion in areas. There's been a lot of ignoring of healthcare professionals in general. And that seems to be, the underlying piece to all of this is they need to take a step back, and they need to start actually listening to the local communities and the local professionals within that community, and say, okay, hang on, maybe what bureaucratically we think is a great idea isn't really going to work in practice, and here's why, and we're going to make changes to how we operate, because right now things keep getting worse and not better, and it simply can't continue. And what they really need to do is be honest with people about the numbers and stop spinning numbers. And so the best example I can give you is in budget estimates. The health minister was asked how many new doctors came to BC, because they kept talking about 1,000. And this was just back in March, April, somewhere around there. And she finally acknowledged that net new is 400. So that's an important distinction of net new, because that means that's an increase to the actual system. Literally a day or two later, in question period, the minister kept repeating 1,000. 1,000 new doctors, 1,000 new doctors, 1,000 new doctors. It didn't matter that her own words in Hansard, on the record, were 400 net new. For question period purposes, she wants to sell to the public that there's 1,000 new doctors. But there's not. There was 600 that retired or left the profession or moved out of those 1,000. And so if they can't just be forthright with people on how big the problem is, or the incremental steps that are being taken when new hires happen, it leaves this very confusing mess out there for the public to try to navigate. And it shouldn't be that way on something as critical as healthcare. We just need clear, concise language and an understanding of what is going on in the system, not whatever is politically expedient in the middle of a question period to fling numbers out that a day earlier you were totally contradictory to as the same minister.
Yeah, I mean, we started covering some of these stories after COVID here with ER closures. I'm sure you see those, some of them in your riding as well. The 100-mile houses, the Quesnels, the Lillooet, the Oliver, all these small ER closures that people kind of ignore because they're just they're smaller communities. Some of them, I think Oliver had 38 closures. And this hasn't stopped. It continues that, and then we had the Kelowna stuff, and now Kamloops. I mean, are we at the 11th hour here? Where are we at in this health crisis in British Columbia? Or is it just mostly the outside the Lower Mainland, or is this starting to show up in the Lower Mainland as well?
No, it's starting to show up in the Lower Mainland. Delta has had ER closures, 4 or 5 this year already. Again, I get oftentimes people of a more left-leaning ideological bent say to me, well, all you do is complain. Where's your solutions? Well, I offered solutions or possible ways forward to minimize ER closures in and around Kamloops and those smaller centers. The media floated it to the health minister, and her immediate answer was no. It won't work. And then, 2 weeks later, they were talking about something reasonably similar, but not really. I'm not saying I have all the answers by any means, but this is not a case of either myself or my colleagues in opposition not willing to try to provide options or solutions or ideas to the government. This certainly is not a case of the healthcare professionals not trying to be part of a solution. This is really a case, quite literally, of the government just continuing to choose to ignore anything and everything that might bring some innovation or change to the system, and actually looking at it in a meaningful way, and having those conversations to try to move forward in a way that actually will see some improvements to our healthcare system.
Yeah, I hear that rhetoric lots where they say, well, this is not the time to speak ill of the profession and that of what's being delivered. Then I say, then let us be part of the solution. Let yourself be part of the solution and share the information, because I understand that the information is being shared. We can't get the information. They have, I don't even know what, over 10 people working in communications here in Kelowna. I've talked to the head of communications here. I said, we can't, it's almost impossible to get a quote. And I said, you have so many people working there, what are they doing? He said, well, we're not allowed to communicate. I'm just okay. So why are we employing all these people if they're not even allowed to communicate? Who's running the show? And I think if you don't want it to be a political crisis, then share the information so that it can be solved for the betterment of British Columbia. Wouldn't that be a fair statement?
Well, absolutely. And again, what was I, I got accused on Facebook yesterday by a few people, and people I know, and I
Yeah.
have no issue with them personally, saying, well, why are you screaming and politicizing this? Well, first off, a few things. First off, I am a politician, so anything I say is political. Let's face it, whether it's partisan or not, it's viewed in that line, and I get that. Also, my official job title has the word opposition in it, so I'm literally paid by the taxpayers to oppose things and to point out flaws in the government. But thirdly, I'd be derelict in my duties if I didn't actually try to make sure the public knew what was going on when you have 7 OBGYNs all resign en masse. And let's be clear, the department that had hospital privileges of OBGYNs in Kamloops is 7. So this isn't like 7 of 15, and this is all OBGYNs in Kamloops that were accredited to work in the hospital, taking the same stand at the same time. And so it's pretty critical. It's pretty important. We have to be out talking about this. It might make the government uncomfortable. It might make NDP supporters uncomfortable to recognize that healthcare is hemorrhaging under their watch. But that doesn't change the actual facts of the situation, that it is happening under their watch. And so that, again, I know I'm going to sound like a broken record here today, but I keep going back to the requests of the Minister of Health have been pretty easy and straightforward in terms of what we expect out of them. What is the plan? When is it going to be implemented, and what is it going to do for long-term stability for maternity services and OBGYN services within Kamloops and into a broader context to the rest of the province? That should not be seen as a partisan political type request when you have 7 of 7 all resigning at the same time, when you have maternity wards in Prince George closing over summer, when you have a pediatric ward in Kelowna shut down for 8 weeks. The government and their spin doctors can try to portray it any way they want. But I'm not going to be quiet and stop asking the simple question to the government: what is your plan? Yeah. You are the government. We all ran to try to be government. They are the government. They are the ones that hold the keys to the Treasury. They are the ones that hold the keys to policy and change. And that was the responsibility we were all seeking in the election. They won it. We didn't. I can accept that. But that comes with the responsibility then to actually deliver. And they are not delivering.
Yeah, and here's some of the comments that, because we leave comments run, we don't like the CBC, we let the comments run, and here's somebody saying, it's Now Media, you only interview conservatives. Are you paid by the conservatives? I would say no. But the other thing is that we ask the NDP, we ask the Liberals for interviews all the time. I just interviewed Brenda Bailey, the finance minister. It was like pulling teeth. I was asking probably like 20 times to get an interview with Brenda Bailey. And I had to actually call them out on the show and to actually get that interview, and they finally relented. We can send email after email after email to the Liberal MPs and get nothing, 0, not even responses. So yeah, if you can help us get interviews, that'd be great. If you can get interviews for us with the CEO of Interior Health and Josie Osborne, thank you for that. But other than that, they try to shut you up, just like they try to do to you, call you a bunch of names. Your job is to hold government accountable. Our job is to hold power accountable. And that's what we do. That's the function of it, right? But if they really want a solution, they should stop using it like a political football and say, here's the data, because we can't get the data either, right? We can do FOIs. I think there's one FOI that's months old that we can't get the information for, and they finally came back, so it's too broad. They wait months to say, oh no, it's too broad, you need to narrow it down. It's just ridiculous, right? It's absolutely ridiculous how they hide and keep the information to themselves and then play with stats. I'm an accountant. I know how to play with stats. You can play with stats all day long, right? And why not be serious? British Columbians know, and they wait in the waiting room for hours and hours and hours and hours and can't see a doctor. 40% of you say Kamloops residents don't even have a family doctor. That's a pretty bad statement for a country that should be as rich as Canada.
Well, absolutely, and again, that when I convey out what I'm conveying out today, today is much more medical, professional focused information that they've been providing me. But I can tell you the number one email I get in my constituency office from people, by and far, with consistency, is a lack of a family doctor and access to a family doctor. And I've been on the waiting list for years for a family doctor, and I can't get one. on. And so, again, the government may be uncomfortable. Their supporters may be uncomfortable that I'm conveying out what I'm hearing from constituents. But last I checked, I thought that was my job. And so, I actually had this conversation with two well-known Kamloops residents that, had lots to say about the state of healthcare when the NDP were in opposition. And they've gone totally silent, because they've been pointed to boards and things like that with the NDP. And I said to them, why are you no longer a community healthcare champion? And they said, well, you're the opposition member, not us. I said, but you weren't elected before when you were championing healthcare in this community, rightfully so, and pointing out under the BC. I'm not saying the BC Liberals had things perfect in healthcare when we were in government. People still needed family doctors, but sadly, it was only 20% at the time in Kamloops, not 40% now. And so, they were pretty vocal then. They've been completely silent. They've been completely silent on things going on with maternity. They've been completely silent on how badly our cancer center is being designed and how recruitment nightmare that's going to be moving forward. And on it goes. So if you want to really cut through the political noise, great. Start being that community and healthcare champion you said you were all those other years, and actually stop worrying about who actually is in government and actually point out the very obvious glaring problems we're having within healthcare, not just in Kamloops, but across the province. The NDP can make up their own excuses. They got their own staff to help shield them all they want. What we need is community members, regardless of political stripe, to just acknowledge what the basic facts are. And the baseline facts are that we have a healthcare system that's in crisis. It's getting worse. We're hearing this from specialty after specialty, and this may be the first. I hope it's the last, but I'm not confident that, frankly, this will be the last specialty that we see this type of thing happen, not just in Kamloops, but across this province.
Are Conservatives ready to lead? Do you guys have a plan? Are you working on a plan? Like, say, if they call an election and the Conservatives win, are you ready to roll up your sleeves and tackle this healthcare crisis? Because, I mean, nobody can doubt that there's a healthcare crisis, especially in the interior and in the broader part of British Columbia in general, outside the Lower Mainland for sure. So what is the solution, and are you ready for it if the opportunity presents itself?
Well, there's no one clear-cut solution, absolutely, and nothing's going to happen in a blink of an eye. But what you do need is you need to have a firm commitment to actually making meaningful changes, and not just protecting. Everyone says the status quo is not working in healthcare, and then when you try to make a big change in healthcare to change the status quo, everyone says, whoa, that's going to disrupt the status quo. We can't do that. So I think we're at a stage, though, where the public is willing to see those bigger changes, where healthcare professionals are willing to see those bigger changes, where you have a system right now that has 3.8 employees to every one manager within healthcare. It is a bureaucratic mess. When the NDP took power, the healthcare budget was $17 billion, 17. This year it's 38. And so it's not a case that money hasn't been dumped into the system. It's that it's being very inefficiently utilized within the system to get the results that we actually want. And what you need is a healthcare system that is driven with results and has actually easy to understand deliverables that you're looking for, be it on wait lists for certain procedures, be it listening to the medical professionals in conjunction with the bureaucracy to make sure that the best decisions and the most efficient decisions are being made within the workplace that does not compromise patient safety. And so, you need to have this. And right now, what it feels like is very much a gatekeeper, just say no mentality by the Minister of Health, surrounded by a bureaucracy that is willing to defend the status quo instead of shake things up and actually give the outcome to the public that I think we're all expecting for that large sum of money going into the healthcare system.
I have one final question for you. Is it a leadership problem? And is the leadership, it's interior health, or is it a leadership at the ministry level, or is it a combination of that too? What needs to change for us to see change, I guess, is the question. Because those are the people that drive change. It's the CEO in interior health and then the ministry. So those are the two leaders, and then plus the premier. Where is the leadership change that's required?
Well, there's no doubt that interior health has a large part to play in this, but every health authority does. And so to try to say that interior health is much different than what we're seeing unfold, sadly, in Northern Health or Fraser Health or Island Health, I think would not be fair to interior health. Again, not the biggest cheerleader of interior health known to man, but I'm willing to actually acknowledge, though, that we have a bigger systemic issue when it comes to health authorities. And that lands right back at the feet of the Minister of Health and the Premier. The reality is, and I've watched this play out in various other areas within the health authority, with interior health, they take their direction, they get their funding from the provincial government. And the minister can try to deflect away and say that, well, that's up to the health authority to deal with or whatever. When it gets too politically hot for them, time and again, the ministry will pick up the phone to a health authority and say, you need to solve this problem tomorrow, or today, or yesterday. It needs to be done immediately. So they don't get to pick and choose. And I used to say this about Adrian Dix all the time. He doesn't get to pick and choose when he gets to have this reputation as nothing happens without his okay and his say and everything else, except for when it hits the fan, and then suddenly it wasn't his problem and his fault. You're either in charge or you're not in charge. And so the Premier and the Health Minister are either in charge of our healthcare system or they're not. And if they're not, they just need to admit it, acknowledge it, and get out of the way. Otherwise, step up, actually show us what the provincial plan is, interior health related specifically for the current emergency that we have, but make no mistake about it. And I've asked interior health this, if this is partly a pay and recruitment issue in Kamloops, how come it's only Kamloops? How come we're not seeing this across the province? And the warning is, you very well could. And so, because it is one system, it's one system of pay, it's one system of how they earn their living. They get treated the same whether they're in Kamloops or Kelowna or Vancouver or Victoria. And so, again, Kamloops might be the canary in the coal mine when it comes to this. And so that's why I'm saying, like, this is bigger than an interior health thing. This is, if ever there was a time that a premier and a health minister is supposed to show leadership in healthcare, now I would suggest would be a pretty good time for them to actually step up and provide clarity to the residents of Kamloops and surrounding area, but more importantly also the rest of the province, just what the heck they're going to do to solve the crisis that we're seeing in OBGYN specialty, specifically in Kamloops and across the province.
Well, we reached out and asked for an interview with both the health minister and the CEO of Interior Health, and we'll see if we get those interviews. I know we're speaking to somebody at communications right now, but we'll see what we get. I think accountability is a big one, and then a lot more gets done if they're held accountable and if they allow themselves to be held accountable. Adrian Dix is one person that was, I think for years we tried to get a comment in an interview from him. It was impossible, right? I mean, that's the bigger part of the problem, I think, right? So.
Well, good luck on your interview request. I know it was a little chillier in Kamloops this morning, but I don't think it was cold enough that hell would have froze over. So we'll see if it actually happens or not.
Thank you, Peter. And if you get a chance to speak with the OBGYNs in Kamloops, reach out to us. We'd love to update the story as well. All right, thank you.
Sounds good. Thank you.
And thank you for watching Now Media.
We don't just report the news. We live here too. We're your neighbors, bringing you stories that matter to all of us. No government funding, no outside influence. Kelowna Now, local, independent. News you can trust.